my name's Sarah and I'm going to perform orogastric intubation on this canine. I am using a cadaver for this task. I've gathered my tube, my sterile lube, some sterile saline for testing the tube placement as though it were a live dog, as well as additional sterile saline to act as though I'm giving medication. I have my 2-inch roll of adhesive tape and we are all set to go. So I'm just gonna get a little bit of a closer look. So the first thing I'm gonna do is measure how long my tube needs to actually go. So I'm gonna measure from the last rib up to the canine tooth. So here, and then I'm gonna mark that with my Sharpie here so that I know exactly how far to place my tube. And I'm gonna have Tate act as though he's holding the dog in sternal recumbency and open the mouth for me. And I'm gonna place in my speculum. And then I'm going to lubricate my tube. And pass it gently down the esophagus. And I'm going to go all the way to my line here. So right there, which lines up perfectly with my canine, I'm going to palpate and make sure that I actually feel the tube in the esophagus. And then I'm also going to put in 3 mils of sterile saline through the tube. You have to use sterile saline just in case you pass the tube into the lungs. That way you don't cause any kind of infection. So I'm going to administer that. And then in a live patient, you would listen for a cough. If they cough, that means you've gone into the lungs. So assuming I hear no cough, I'm going to go ahead and administer my medication. And then as I remove the tube from the stomach, I'm going to hold my finger over the entry point so that no liquid can come out while I'm removing the tube. That way there's no risk of the patient aspirating into the lungs during tube removal. I'm just slowly going to remove my tube and put that right into the trash. But that's how you perform orogastric intubation on a canine.